Evening, and thank you for joining us for our Mid-Year Family Forum. I certainly hope that you had a safe and fun snow day today. Of course, it was unexpected, but hopefully fun nonetheless. The purpose of tonight's event is to provide our community with an update on our health and safety mitigation strategies, on-campus and virtual learning, and district communication tools that have been implemented since school started this year. While some of the information covered tonight may be specific to option 1 families, whose students will be on campus regularly, and other information may be specific to option 2 families whose students will receive daily online instruction. We recognize that there could be times when option 2 students need to come on campus for a specific purpose, or when option 1 students need to move temporarily online. So we felt it was important for everyone to hear all of the information together, so there will be some overlap. We just want you to know that up front. Additionally, with the second semester beginning next Wednesday, we will have just over 800 students switching from option 1 to option 2, and almost 3,300 additional students coming on campus for the first time this school year. So we want to answer any questions you may have to ensure those transitions are seamless for our students. We have several presenters here this evening, members of our central office team, who have done great work to prepare school for our students this year. And we're going to cover a great deal of information. I've asked them to include answers to some of the most frequently asked questions we've been receiving. We encourage you to listen to their presentations in their entirety, and then afterwards use the Q&A feature in the bottom toolbar to submit any additional questions you may have for that presenter. We have several team members from various departments on our Q&A panel this evening who will be responding throughout the webinar as quickly as they can. We will begin with updates from our Division of Student Support Services under the direction of Dr. Jacqueline Miller. Dr. Miller?
Thank you, Dr. Cotton, and good evening, everyone. Tonight, the Division of Student Support Services will provide parents with updates and reminders regarding enrollment and attendance, student transportation, athletics, and lastly, you will hear about our important health and safety mitigation strategies that are vital to keeping all of our students and staff safe. We will begin with Dr. Sandy Brooks. She is the Supervisor of Student Enrollment and Supports, who will be followed by Dr. David Benson, Director of Student Transportation. Up next will be Mr. Kevin Cole. He is the Supervisor of Student Activities, and we will round out our Division of Student Support Services with Ms. Trudy Gelderks, Supervisor of Health Services. Mrs. Gelderks. Mrs. Dr. Brooks. Sorry.
Good afternoon. Okay, all right, good afternoon, everyone. Please make sure that you update parents, that you update your mobile apps and your bookmark links to the Parent View and Student View accounts. Now, parents who have not activated your Parent View accounts, you should contact your student school as soon as possible to receive your activation code. Okay, all parents will be required to renew their COVID-19 health commitment in Parent View. We are discontinuing the daily digital health screenings, but we are stressing the importance of staying home when you are sick. Mrs. Gelderks will elaborate on this a little further into the presentation. Now let's quickly explore this new report and absence feature. Okay, on your home page in Parent View, parents will see a new blue button beside the name of each of their students. Okay, this new report and absence button is easy to find whether a parent is using the computer or the Parent View mobile app. The parents will actually enter basic information regarding the absence. Parents will also be able to upload a medical note or any other supporting documentation. Parents will receive a confirmation on the same day that they report the absence. And then on the attendance tab in Parent View and Student View, parents and students will immediately see the absence reported. This new feature replaces the need for parents to call the school or to send handwritten notes or even emails. A YouTube video will be provided on our website to assist parents with this new process. And remember, this all begins with the new semester on Wednesday, February 3rd.
Dr. Benson.
Good evening, everyone. I do have a few updates from the Department of Student Transportation, and I would like to begin by letting you know where your bus routes can be found.
That'll be on the next slide.
On our division website, we do have a link available for you to find your child's bus route. And on our webpage, as you can see highlighted on the screenshot from the webpage, there is a yellow link down below that has transportation underneath. Once you enter this link, you will be able to scroll down to the bottom and find your child's individual school, and underneath each individual school, all the routes are listed. Just for your information, the routes are going to be completed as if all students that are scheduled to be on that route are attending in person. However, I do want to let everyone know that due to restrictions to the number of students that are going to be able to ride on the bus, some of the routes could be delayed. And speaking of the bus restrictions, under our COVID restrictions, there will only be one student allowed per seat unless they're coming from the same household. And this will be the only time this would not fit is if they had a mask or had an exemption as far as, let me go to if we can get the next screen. There we go. Under mask exemptions and face coverings requirements, all students will be required to wear masks and face coverings while on the bus. And the only time that this would be altered is if they have been approved for a mask exemption, which can be done through your school nurse. And also wanted to let everyone know that we're making every effort to keep our buses safe for all of our riders. All of our buses are disinfected and sanitized after every AM and PM route. And in addition to that, we do have our drivers have been equipped with supplies to wipe down frequently touched surfaces such as handrails, tops of seats, and other surface areas throughout the bus during the day.
Mr. Kevin Cole, Student Athletics.
Good evening, everyone. Just updates from the athletic department. Our academic activities were scheduled to resume today, but due to the snow, they will resume tomorrow. Our football and cheer teams will start tryouts on Thursday, February the 4th. Cross country, field hockey, volleyball, and golf will start tryouts on Monday, February the 15th. And our Chesapeake Middle School League athletics and activities are on hold at this time until all of our students have returned to school 5 days a week. Thank you.
And we'll round out with Mrs. Trudy Gelderks with Health Service, Supervisor of Health Services. Trudy.
Hi, good evening, everyone. I wanted to cover a few topics that are near and dear to all of us. One is mitigation strategies. Quarantine versus isolation. We're going to talk a little bit about mask shields and a layered protection that we've added to our schools this second semester, as well as vaccinations and immunizations. The very first, this one specifically I wanted to touch base on is mitigation strategies are incredibly important. As we layer on our different mitigation strategies, studies actually show that they actually cut down on both the transmitting and catching of COVID virus. Some studies actually hint that the masks might reduce the severity of infection for people who do contact the disease. So you'll notice that our Swiss cheese model that we use is talking about adding on, and every time the COVID virus goes to the next mitigation strategy, it's less likely to survive, therefore it's less likely to transmit. Our key mitigation strategies that we've been really focused on this school year is mask usage, our physical distancing, hand hygiene, our cleaning, and our contact tracing. To do this, we must all remain committed to implementing our key strategies with fidelity. This means we will continue our safety audits and provide more layers of protection should we identify anything, we learn any lessons. We're just going to add another step to make sure that we can ensure and protect our students and our staff. So this particular slide is a really good visual to represent the chance of transmission from an infected to an uninfected person. Regardless of the symptoms, if a person is positive, they're contagious, and the best defense is to wear a mask and keep your distance. Some people are concerned about asymptomatic transmission in the school. The reality is, if you're doing the mitigation, then this is not going to happen. The proof is in very few of the schools have actually demonstrated transmission and have not been identified. So what we're saying is, you know, the best case ever scenario is if everyone stays home in their own little bubble. However, once you attend school, as long as you can maintain that 6-foot distance and wear your mask, those are the two key pieces there. The chance of transmission is very low. These are the additional layers of protection that we were talking about. 12,000 desk barriers are delivered to our elementary schools last week, and our Option 1 students now have an extra layer of protection right at their desks. Mitigation strategies like these may help prevent the spread of illness in schools, and while we are not seeing student-to-student transmission in our elementary schools, this provides an extra layer of protection to both the students and the staff. Middle and high schools that are operating in tighter classroom environments will also have availability of these extra desk barriers.
And I'm so happy that we have a special guest with us. It's our own school-based epidemiologist, Mrs. Jenny Hahn. And I think she's going to come on now and do the next slide.
Thank you very much. This is Jenny Hahn from the Chesapeake Health Department. I'm glad to be here. So there often is a confusion between isolation and quarantine. So isolation is for somebody who's actually contagious and sick with COVID-19, and so they need to stay away from others. That would include people within their own house. So it's very important that they isolate away. Quarantine is a mitigation strategy that we use to make sure that anybody who's exposed to somebody that's positive, that they stay home, they stay away from others, so that if they do end up becoming symptomatic or positive, they can not infect other additional people. Next slide, please. So this is the graphic from isolation and quarantine. I was gonna try to put it on the chat for you. But basically, again, isolation means that you're infectious, that you're contagious, and that you can get other people sick, while quarantine is a protective measure, meaning that you were a close contact. And so I think it's important to realize that if someone in your house becomes ill and they cannot completely separate from you, so if a parent becomes sick and the students can't separate from their parent, then the students actually end up having a longer quarantine period because they have to wait the full 10 days of their parents' isolation and then move into the quarantine period of 2 weeks. So it ends up being a 24-day quarantine period. This next slide talks about Sally. And Sally, so this is a good way to kind of get it in your heads. So if you're exposed to, Sally's exposed to COVID-19 on day 0. At day 5, she gets tested and the results come back negative. So on day 8, she thinks she doesn't have COVID-19. She attends school, a family cookout, and is contagious. Because on day 10, she actually became symptomatic and tested positive. So the weird thing with COVID is that you're for 2 days prior to symptom onset, you're contagious. So that 48 hours is critical. So it's important that the quarantine period is for the full 14 days, and that helps protect everybody around you. Next slide, please.
So I'll take over from here.
Thank you.
You all as parents play an important role. Your diligence in monitoring and screening your child assists us in keeping the schools open and prevents the potential spread of COVID. I can't stress that enough. Your diligence is what keeps the schools open and prevents the potential spread of COVID. So please listen to your child when they don't feel well. If they're not acting themselves, please give us a call and don't send your child in. Keep them home, even with the mildest of symptoms. Remember, COVID doesn't develop overnight. So you have a student that has mild symptoms and the symptoms will progress. So when you send them in with those mildest of symptoms, we're putting other staff members and students at risk. So please listen to your children when they say they're not feeling well, they're not acting themselves. Please keep them home, even with the mildest. And if somebody in the house is being tested, evaluated, or demonstrating any symptoms at all, keep your student home, call your health advisor for the next steps. Remember, quarantine is a mitigation strategy that we employ. Stay home, protect your family, your friends, and your community. So the commitment form that Dr. Brooks previously mentioned will be available. This is for second semester. So every parent needs to go in there, review the health commitment in parent view, and make sure that you understand what those means. If there's any questions in regards to what any of these 8 items are on this health commitment, please make sure that you ask your school health advisor or call over here to health services so that we can answer them for you. Acknowledgement of this is required for second semester. So please make sure that that is done and that you read it and you understand what that means. So I've had a couple questions. So my last slide, I wanted to kind of give you a little bit of update in regards to your immunizations and your vaccines. People are asking, oh my goodness, when's it going to be available for us? COVID vaccines are currently under review and study. Both Pfizer and Moderna currently have indications, with Pfizer being 16 and 17-year-olds, and Moderna is approved for 18 and over. But currently there are studies underway to look at the use of these vaccines in younger populations. Unfortunately, they're not currently available, but we will certainly be watching them, reading the studies to see when that will be an option. The Virginia Department of Education also has a requirement that has not been waived, and that's in regards to their immunizations required for enrollment and for certain ages. So they've not been waived due to the pandemic, and they apply to all students admitted, whether they're learning virtually, hybrid, or in person. So if you have a child's appointment coming up for their physical and they're aging up, and they're requiring a vaccine, please work now to get them so that they're not delayed, because we can't enroll the students without them.
Thank you, everyone. That concludes information from the Division of Student Support Services. And now I will turn it over to Dr. Latoya Harrison, who is the Chief of Teaching and Learning. Dr. Harrison?
Thank you so much, Dr. Miller, and good evening, parents and family members. This evening, I'm going to be sharing some important updates from our Teaching and Learning Department. And I also want to just take a moment to thank our Teaching and Learning team. Many of them are here this evening and responding to your questions in the chat. So please, throughout our presentation, please continue to add your questions to the chat, and we will be sure to respond to you. I'd like to begin this evening by discussing a recent change to our school calendar. At our January 11th school board meeting, the school board approved the addition of 6 asynchronous student support days to accommodate the upcoming vaccination clinics for our employees. Therefore, 6 dates have become asynchronous student support days for all students, meaning students will work independently on these days with support from teachers when possible. Students may use this time to work on independent learning activities, and teachers may schedule student support opportunities around their appointment times. This could include some of the activities you see listed on the slide here. This added flexibility will allow our employees the opportunity to attend a clinic to receive a vaccination or to assist with the event. Teachers have been instructed to provide details about the schedule for the day so that families will know what to expect. As we prepare for the start of the second semester, let's take a look at how our family choice numbers have changed. In December, families made a choice for the learning option that would best fit their circumstances for the second semester. This commitment will be in effect from February 3rd through the remainder of the school year. Parents who did not confirm a change for their children were defaulted to their first semester option. Here you can see an overview of the numbers by option for the first semester compared to the second semester. A total of 826 families chose to move their student from option 1 to option 2, while a total of 3,261 families chose to move from option 2, virtual learning, to option 1, on-campus instruction. To accommodate these shifts, a small number of students at the elementary and middle school levels may have a different teacher or team assignment as a result. We've made every effort to keep any necessary schedule adjustments to a minimum. Schools will be hosting special transition events for impacted students and families before the new semester begins on February 3rd. Families are strongly encouraged to attend these events or meetings and contact their child's school with any questions or concerns. And of course, the majority of our high school students are on the block schedule, so they will begin the second semester with a new course load as they would normally do. As a reminder, report cards for the first semester will be available for elementary students the week of February 11th, and they will post for middle school students on February 8th and for high school students on February 5th. As you know, Chesapeake Public Schools launched a new learning management system in the summer of 2020. Schoology houses the division's curriculum and instructional resources and also serves as a means to share teacher lessons, assessments, and feedback with students. It is a one-stop shop for our faculty and staff, and we appreciate our administrators, teachers, students, and families who have done such great work learning how to use this new learning management system. When you're in need of assistance beyond what your student may be able to show you, please know that your child's teacher is your first point of contact for any assistance you may need, followed by the school's technology integration specialist. And then, of course, you may also email our Schoology support for additional assistance for any questions that still need to be addressed. As students transition to a new semester, students in option 2 and those on the blended schedule should anticipate a slight change in our expectations for student cameras during instruction. Teachers who are using Google Meet may request that their students have their cameras on during class sessions because of the new blurred background feature available in Google. This allows students to participate with their cameras on while still protecting their privacy. Also, I am pleased to share that our one-to-one initiative has launched in a condensed and impressive timeline. Our students and teachers have access to new Chromebooks, which gives them uninterrupted access to Schoology, various web-based instructional programs, and of course, real-time classes through Google Meet or Zoom. We have an ongoing commitment to ensure equitable access to technology in Chesapeake, and our one-to-one initiative is the giant leap in that direction. If you have any Chromebook-related questions on distribution or implementation, please be sure to contact your child's school for additional information. Additionally, to assist our teachers at the secondary level with dual roster classes, where students in person and at home are learning together, we have acquired 1,000 rotating cameras and anticipate installing them over the next few weeks. These devices will track teachers as they move around the room during a lesson. In doing so, it helps to ensure students who are learning from home won't miss an important moment and gives the teacher more flexibility during the lesson. As our teaching and school days have evolved to include richer use of technology in the classrooms, we've responded with access to effective instructional programs. Here you will see a list of software we have made available just this school year to provide an engaging virtual and online experience for our students. For example, WeVideo is an exciting product that allows our teachers to create and edit instructional videos for their students. We also have Nearpod, which is available across K-12 and gives the teachers the tools to create lessons with embedded activities, assignments, or assessments. Both are fun and creative ways to deliver instruction online or in person. You also see additional programs listed that enhance the learning experience with timely feedback, individualized or adaptive approaches, opportunities for independent reading and writing practice, and connections to a wealth of relevant, secure online materials. The vast majority of the updates that you're receiving today apply to all students, including our exceptional learners. That said, I do want to take a moment to share some items that have been implemented recently and are uniquely aligned with our special education and gifted learners. Two exciting developments in our Office of Special Education include the implementation of the Presence Learning and the Unique Learning System. Presence Learning provides a platform for our related service providers, speech language pathologists, occupational therapists, and physical therapists to connect virtually with students in a more effective manner. Presence Learning allows for expanded virtual assessments and teletherapy. The Unique Learning System is an online learning system that is designed to be used with our students who have significant cognitive disabilities and are pursuing alternative standards and instruction. Both of these initiatives will provide increased opportunities for student engagement and achievement for both in-person and online instruction. The Gifted Education team has continued to collaborate with classroom teachers to meet the needs of high-ability students. The elementary team is focused on training and resources for implementing concept-based curriculum in a blended learning environment, and the secondary team has focused their work on supporting the social emotional learning needs for gifted learners during the challenges of the pandemic. To assist with learning loss that may have occurred as a result of the COVID-19 pandemic, remediation and intervention support sessions will be provided at each school for students in need of additional instructional support or assistance. School administrators have been asked to design remedial sessions using research-based strategies that will help to reinforce the instructional content. Remediation and intervention plans may include, but are not limited to, after-school virtual tutoring sessions, small group pull-out sessions during the instructional day, after-school virtual remedial sessions, Saturday virtual tutoring sessions, and so on. We also want to take a moment to remind families of the importance of student attendance in online class sessions. Daily attendance in teacher-led learning sessions is important to student success. However, we also recognize that there will sometimes be extenuating circumstances that might prevent students from participating in the live class sessions. In these cases, teachers may count students as being in attendance when students show evidence of a meaningful interaction in lieu of participating in the live class session. Examples of meaningful interactions include collaborating with a teacher one-on-one or in a small group during teacher office hours, submitting an independent learning activity, assessment, or participation in an online discussion board in Schoology, or communicating with the teacher via email, video conferencing, or even a phone call. This next slide highlights general homework expectations from our school board policy. The times presented here are general guidelines used by our teachers when assigning homework. During this challenging season, teachers have been asked to carefully consider the amount of homework being assigned to ensure that it is appropriate, aligned to previous instruction, and used to build skills and understanding. While homework may look different at each level, in most cases it should be within these general timeframes. If you find that your child consistently exceeds these recommended times when completing assignments, please feel free to reach out to their teacher to discuss homework expectations and any additional support that may be needed. You've also probably noticed some changes to our division's assessment program. We've worked diligently to streamline division level assessments wherever possible to maximize time for classroom instruction. This year, our division purchased NWEA MAP Growth as an assessment tool to determine the learning gaps for our students and to measure growth from last fall to this coming spring. Unlike an SOL test, students can take this assessment either at home or at school. The MAP family report will come home with report cards at the end of this semester. The adults who support our students' learning at home will find this information especially helpful to give a portrait of a child's strengths and challenges. Teachers also get very detailed diagnostic data to help them customize instruction. We've received some questions regarding the administration of the Standards of Learning SOL test. Virginia SOLs were waived for the spring of 2020 when all schools were closed and offering only virtual instruction. However, they are still required this year, and they are required to be given in person. The high school first semester testing window ends March 5th, and we have scheduled our high school SOLs to be offered during that time. Spring 2021 SOL testing will occur for our students late May through early June. We have been asked if this is required for all students, and parents are permitted to opt out of having their child participate. However, it is important to remember that it is a state graduation requirement if the SOL is needed as a verified credit for a high school course. Our school counselors can tell you if this is the case for your child. And of course, our schools have developed plans to ensure that our option 1 and option 2 students have a safe testing environment. I also wanted to take a moment to share updates on AP testing. In a recent meeting with our College Board representatives, we learned that the 2021 AP exams will match the traditional published exam descriptions. AP exams will be full-length paper pencil exams administered in person in schools. The College Board is preparing an updated testing schedule with 2 contingency testing dates for each subject in May or June. The AP exam schedule and information about the contingency testing options will be posted by the College Board in early February. All AP resources can be found in each student's AP classroom and are built for in-person, hybrid, or online environments. Live online review sessions will be available to AP students from April 19th through April 30th. And this concludes our second semester updates from the Teaching and Learning Department. If there are any additional questions that have not been answered, you may place them in the chat and we will respond there, or you may feel free to email me at latoya.harrison@cpschools.com. Next, I would like to introduce Dr. Angie Smith, who will be providing important updates from our communications department.
Hi there, good evening. Tonight, before we wrap up, I'm the last on the agenda, just want to take a minute to share some information from the Division of Communications and Strategic Planning. And we too have several team members on the call tonight acting as panelists to help answer your questions in the Q&A box. We have Ms. Elena Trott, who you saw, the Director of Strategic Initiatives, helping us conduct the forum tonight. We also have Dr. Molly Sullivan, Supervisor of Strategic Initiatives, along with Mrs. Andrea Vale, who is our Administrator for Business and Community Partnerships. Our division really seeks to engage, inform, and collaborate with the community. And we use a variety of platforms to work towards this purpose, including those that you see here on the screen. We're always looking for ways to try to connect with the community and to help provide resources or information that you might be looking for. Basically, we try to connect you to the information that you need. So if you ever feel like you missed a message, or perhaps you're not confident that your name is on the email list for your child's school, we can help you solve those types of issues. issues. We also are looking for your feedback. And so you can always pick up the phone and call, or you can reach out through one of these platforms that you see here, share your concerns, your comments, your suggestions, and we will work to get that information to the right place. If you're interested in reporting anonymously, that's an option as well. You can use the Let's Talk Contact Us form. It's on our website that has an anonymous reporting feature, but we also have something called Quick Tip that's available on our website, but it's also on our COVID-19 dashboard that we're going to talk about in just a couple of minutes. But if you're using that Quick Tip system, what's nice about that is you can actually report your concern anonymously or not, but it'll go directly to the building administrator where you have that issue. So that's another great feature. Next, I just want to share some information about some resources for parents that you might not be aware of. We have the Family and Community Engagement Office. The ladies there do an excellent job trying to assist our parents, just making sure that they have a great opportunities to support their child in their learning. And we have these technology tutorials. These are actually individual technology tutorials by virtual appointment. The sessions will include a basic demonstration of the platforms, Schoology, Parent View, and others from the parent's perspective. And there's going to give you some practical tips on how you can manage your child's academic progress. It's not an IT help desk though, so I want to make that clear. This is really kind of an educational opportunity to learn how to manipulate those systems, how to work those systems. We ask that parents activate these accounts before they schedule an appointment. If you have trouble with that though, just give us a call. We can certainly make that happen. The URL that you see on the screen here is what you would use if you'd like to request an appointment. Then finally, last up, I just want to talk a little bit about our process for communicating positive COVID-19 cases and how that information makes it to the dashboard. When our health services team completes their investigation, when they are alerted to a case and they do the contact tracing, and they get all of the information that they need and they're confident that they have everything taken care of, that's when they're actually going to reach out to our team to provide the details that we need to update the dashboard and to set up the courtesy notifications. Courtesy notifications are sent to anyone who may have shared space, it might be a classroom or a bus, with an individual who tested positive, but they're not considered a close contact or to be at any personal risk. So there's no action required, but we do want to provide that alert. So when we get that information, we contact the principals so that they can share those details with their staff before the information is posted on the website. We prepare the web updates right around 3 p.m. each day so that they'll be ready to go at 4 on time. So if we happen to be alerted about a case after hours, then that's going to be reported the next day. Now, what you saw on the previous slide was a snapshot of our website, and we have the tab called Return to School. If you select metrics and case data, you'll actually reach the point where you get a link to this dashboard you're looking at right now. It's a light blue button, and it'll take you directly to this page. And as you can see, this is just an overview on how our COVID-19 might be impacting our school operations. And earlier in the year, we launched this dashboard. It's really purposeful. We really wanted the school community to see the same information being considered by the leadership team on determining if a shift in operations was necessary for our schools. So the data that you see, it's really intentional, and we'll continue to develop these dashboards as we get feedback and we refine our process. But as you can see, when you explore them, the first thing that you'll notice on that left-hand side, that's where you'll find the number of positive COVID-19 test results reported by school location across the district. Now, I want to emphasize this is not simply for your option 1 students or staff. We get that question a lot. This dashboard actually includes results for anyone who reported to campus for any reason during their contagious period. You talked about that 14-day window earlier and how important it was to quarantine. That's really what we're looking at. And the reason we do that is because we need to see a clear picture of our campuses to see if there's a spike in cases in one particular building that may require attention. Now, this dashboard also includes any possible outbreaks. And if you can scroll down just a little bit, you'll see that we include a link to the VDH school outbreak dashboard where you can learn more details about what they classify as an outbreak. Now, outbreak means that there's a confirmed transmission from one person to another. That's all it takes to use that scary word outbreak, is that we know one person transmitted the virus to another. And so I want to point that out because in some cases, you'll see a very small number of cases in the building, but if that transmission occurs, then it may rise to the level of what the health department says is an outbreak. The information on that table, if you'll scroll back up on the left-hand side, you'll notice it's updated daily. So as I said, 4 p.m. each school day, or each business day, I should say, that's when we're going to update that table. Then if you look on the right-hand side, you're actually going to see the number of students in each learning option, both option 1 and option 2, kind of at the district level. If you dig a little bit deeper, there's a link there and you don't need to open it, but when you get a chance, pull it up and you'll see on that dashboard, you can see the breakdown by school level. And this is important and intentional as well, because we want you to get a mental picture of how many people are actually visiting our schools at one time. Remember, at the secondary level, the numbers that you'll see on that dashboard have to be cut in half because we're on that blended model right now. But that just kind of lets you picture, what would the space look like in a building of that size. That information is updated monthly. Now, just below that, where you see quarantine data, you get a nice screenshot on the main dashboard of the percentage of people across the district that are actually visiting our campuses or in quarantine. And then again, we have a link to the quarantine dashboard where you get to see a breakdown of those numbers by location. And that would include both students and staff members, school by school. And again, this is on purpose because we want you to understand, is it possible to have a school with no cases in the school, but a high number of people in quarantine? Well, yes, because quarantine is a mitigation strategy that's often used. And if you happen to be somewhere in the community and get exposed and you're put in quarantine, you might see a rise in that school with a high number. So we just want you to have that snapshot school by school, and that's really to help you get a picture of, are we able to operate efficiently? Because that's another reason that we might need to make a shift. Now, finally, back to the main dashboard, you'll see a few other bits of information that are just important definitions and other resources. And there's also the quick tip link is on there. It's kind of on the bottom on the right-hand side that I was talking about earlier. She's going back to it. The quick tip feature is where you can actually report your anonymous concern. And we really take this very seriously. We think it's important that all of our employees and our students are taking these mitigation measures, there it is right there, taking these mitigation measures seriously. And if you have a concern and you're afraid to speak up, we completely understand, but you can use that link and it will actually, provide the information directly to building administrators and it can be addressed. And that's what we need to do. We're really all in this together, making sure that we're consistently implementing those safety measures. So bottom line, with all of the information that I've sort of presented to you here, hopefully I've met our time limit and I'm not taking up too much of your time tonight. Our main goal is just to be as transparent as we possibly can while both protecting the identity of any infected students or staff members. And we're here to help. So if you have any questions, give us a call or reach out on one of those platforms. As I mentioned, we'll do our best to assist. And so as I wrap up, if you have any questions, just type them in the Q&A, or you can always reach out, angie.smith@cpschools.com. And that sums it up for us.
Thank you very much. I would like to thank all of our presenters and attendees and all of our panelists who helped answer questions throughout the presentation. I think we answered lots of questions. I believe we got to all of them, but any that we did not get to, we'll certainly add to our frequently asked questions and answer those on our website. In addition to the information presented, we will continue to modify and change and improve our practices as we move forward, because as we continue to point out, we learn something every day as we continue to move through this process. As we prepare to transition to the second semester, if you have any additional questions that arise, we encourage you to reach out to your child's school or submit them through our Let's Talk feature, which you heard about this evening, and that's right on our website. A recording of this webinar will be posted on Chesapeake Public Schools YouTube channel tomorrow, so you can easily reference this or share with a family friend or someone in your community who didn't get to attend, and they'd be happy to receive this information as well, I'm sure. And we thank you for your continued support and flexibility as we continue to navigate through these unprecedented times. Rest assured that we are committed to working closely with our families, with our students, with our medical experts, and several of our community members to continue to improve safety for our students so that we can continue to provide options for our families, both in-person instruction as well as online instruction. And we're committed to providing both of those opportunities for our families. So thank you for all that you do, parents, because you are a critical partner for us as we continue to navigate these challenging waters. We could not do what we do without you and without your support. So thank you for all that you do. I wish all of you a good evening, and thanks for your participation tonight.